All right, so I decided to do my presentation on obesity, and my name is Stevana Dimbe. And the reason why I decided to do this as my final presentation is because I find obesity pretty interesting. Us as Americans, we suffer from it a lot. So I feel like it's a topic that needs to get talked about a lot more. So, yeah, that's why I decided to do obesity. Here we go. I hope you guys enjoy it. Things you will learn in this presentation about obesity. What is obesity? What causes obesity? What are the effects of being obese? How to prevent obesity? And treatment of obesity. What is obesity? Obesity is a medical condition in which excess body fat has accumulated to the extent that it may have an adverse effect on health. It is defined by body mass index, BMI, and further evaluated in terms of fat distribution via the waist-hip ratio and total cardiovascular risk factors. And I received this information from the Wikipedia. How common is obesity? Over 2/3 of adults are overweight or obese in the United States. The prevalence of obesity in children has increased markedly. Obesity has rapidly increased throughout the world, and the evidence of obesity nearly doubled from 1991 to 1998. In 2015, nearly 40% of adults were obese in the United States. If you look at the chart I have on the right, it talks about the stunning rise of obesity in America. It looks like back in 1960, men were more overweight than women. And as the years went on, women became more overweight than men. The chart has the years from 1960 up until 2014. What are the causes of obesity? Obesity is generally caused by eating too much and moving too little. If you consume high amounts of energy, particularly fat and sugars, but do not burn off the energy through exercise and physical activity, much of surplus energy will be stored by the body as fat. Some other risk factors are family inheritance and influences, lifestyle choices, social and economic status, certain diseases and medications, and age. On the right, I have a picture of causes that can happen with having obesity. And some of the things are genetic, like it said in like it said in the on the left on the slide. It also talked about sweetened drinks, hormones, medications, and insufficient sleep. It also talks about smoking. And one interesting fact about smoking is if you're a smoker and you are trying to quit, usually that can lead to obesity or you becoming overweight because you are trying to eat and supplement the cigarette. So that's why a lot of former smokers become obese or overweight. I found that very interesting as I read that in one of the articles. Here is a list of some health effects of being obese or overweight. High blood pressure, hypertension, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, sleep apnea and breathing problems, many types of cancers, low quality of life, mental illness such as clinical depression, anxiety, and other medical disorders, body pain, and difficulty with physical functioning. And on the right is a picture of the different diseases that can happen if you become obese or overweight. How to prevent obesity. Eating a healthy diet and getting more physical activity can prevent obesity. Consume less bad fat and more good fat. Consume less processed and sugary foods. Eat more servings of vegetables and fruits. Eat plenty of dietary fiber. And focus on eating low glycemic index foods. On the right, I have a picture of fast food and then fruits and vegetables, and it talks about weighing out your options and how fruits and vegetables are a better option versus eating out. I understand that it's hard at times if you have a busy life like myself to just grab food to go, but it's much healthier to cook your own foods and to put fruits and vegetables in your diet, and also exercise. Treatment of obesity. Here are a few things that can treat obesity. Healthy eating plan and regular physical activity, changing your habits, weight management programs, weight loss medications, weight loss devices, surgery, surgery, special diets. And then on the side, I have a picture of a scale. Here are some graphs on obesity regarding sex and race from teens and adults. On the left side, I have a graph that talks about the percentage of by race and sex, so men and women, age 20 and over. So it looks like African American women or black women are the highest with the obesity percentage. After African American women, it's Hispanic women. After Hispanic women, it's white women. And then Asian women, they are last with 15%. And then if you look at the men with the highest percentage of obesity are Hispanic men at 43%, white men with 38%, black men with 37%, and Asian men with 10%. If you look at my other chart or graph, I have the percentage of males and females ages 12 to 19 who are obese by race or Hispanic origin, and this was made in 2015 and 16. And it has the total on the left side, which is 19% of males had a higher percentage of obesity rate, and then 18% of females had a percentage of being obese. The highest on this graph are Hispanic men at 28%. After Hispanic men, there is non-Hispanic black, so black males at 19%. After black males, it's white males at 15%. And then after white males, it's Asian men at 12%. For the women, African American women, black women are at 25%. After black women, it's Hispanic women at 24%. After Hispanic women, it's white women at 14%. And last but not least, Asian women at 10%. Here are my references and where I got my materials. I hope you guys enjoyed the slideshow, and I look forward to seeing all of yours. God bless. Thank you.